Yes.
Okay. Yes, please.
Okay. A very warm welcome to everyone who's attending today's online open day of LACA. So when we were trying to set up this the college, we thought of many names, and this one came up to us because it sounds fun, but also had a greater image of the letters coming together. So this is the first time officially we claim our college, the London Academy of Chinese Acupuncture, is formally established. So welcome to everyone. We're going to have some brief introduction about our courses, and then we have our 5 initial lecturers to introduce their own speciality in today's event. So first of all, I would like to introduce the director of LACA, Professor Tianjun Wang, and to give us introduction with those courses and the college. Thank you.
Okay, thank you, Dr. Ye. Thank you everybody to join this special event, the first online open day for our new established higher education in London. We call the London Academy of Chinese Acupuncture. Let me start a very short presentation to introduce our academy. Yeah, first of all, as you may understanding, there are several courses in our academy. First of all, the 2 basic training courses are Diploma of Chinese Acupuncture and Diploma of Chinese Herbal Medicine. These 2 courses are the main course in our academy we provided for Western interests, Western students. And then we also have some certificate courses, such as the Certificate of Tcm Massage, Certificate of Apprenticeship with Masters, and we have plenty of the CPD courses as well. We will say, why study with us, with London Academy of Chinese Acupuncture? As you may know, in the UK, there were several universities provide Chinese medicine, acupuncture, higher education in about 10 universities. But unfortunately, due to several factors, almost all of them has already closed, or some of them has not enrolled new students at all. There are several other reasons, but there are still some private setting colleges to provide Chinese acupuncture and Chinese medicine education in the UK. In terms of London Academy of Chinese Acupuncture, a quite commonly asking question is, why study with us? We are new, very new. This is a very special time, just after this pandemic. Why we started in this difficult time to our academy? So we'll say there are some key factors for our academy. First of all, to study Chinese acupuncture and Chinese herbal medicine with Chinese lectures. We will introduce all our key lectures of academy are Chinese-based and Chinese-based acupuncture and herbalist. And we all practice in the UK. All our key lectures hold a PhD degree from a Chinese Tcm universities in China. And also, all our integrated, our courses are all integrated basic theory taught with hands-on practice. We are all, as you know, all our lectures are also practice as well. So we are holding the practice in day-to-day basis. Our academy central clinic with supervisors, plus we have no-com clinical with mentors which located in almost all the areas in the UK. We're providing blending ways of online learning and class teaching as well. So these are some of the key factors of our academy. Let's move on.
Excuse me, Professor Wang.
Yes.
Would you mind just turn the slide into full screen, because it looks like it's too small for the viewers.
I see. Sorry. Yeah. Okay. That's it. Okay.
Yes.
So
thank you.
This is our team. As you can see, we are all Chinese face, but of course we are actually Chinese. We all born in China. We all get our TCM acupuncture and Chinese medicine high education in China, and also we all holding a Chinese medicine PhD degree, including myself, Dr. Tianjun Wang, PhD, and our vice principal, Tiejun Tang, PhD, and our dean of teaching, Dr. Liu Zongye, PhD, our senior lecturer, including Dr. Jun She, PhD, and Dr. Yonggang Han, PhD. So you can find all the introduction of our key lectures on our website. Now we move on to one of the key course, which is Diploma of Chinese Acupuncture. This course, I am the course director, or you can call the program leader of this course. So I will start to introduce brief into this course first. This course will cover, first of all, the basic theory of traditional Chinese medicine, including the Chinese medicine foundation and the Chinese medicine diagnosis, including, as you know, the tongue, the pulse, etc. The diagnosis of Chinese medicine, we will cover the commonly used acupuncture points, meridians, with our deep understanding. We will introduce all the relevant practical acupuncture techniques, including not only the needling, but also the moxibustion, cupping, electroacupuncture, scalp acupuncture, ear acupuncture, etc. All these techniques will be introduced, follow the Association of Chinese Medicine in the UK for the safe practice, and they are all practical in the UK. And some of us we are very special on this area. So some of these techniques and these courses will be also provided for public as a CPD course as well, such as if someone were interested about electroacupuncture, about the scalp acupuncture or ear acupuncture, you can just join this one-day course as your CPD program. And also, of course, we will introduce the classic text of acupuncture for our understanding learning. This course, Chinese acupuncture course, will be in duration for 3 years, including 180 hours class learning per year, of course, times 3 years, and also will cover 300 clinical hours. This 180 hour clinical class teaching and the 300 clinical hours are all covered in a blended learning, including the online teaching and, of course, hands-on practice in class and in clinic. The course fee at the moment is 3,300 pounds per year of 3 years. That means in totally 3 years, less than 10,000 pounds, you can complete your Chinese medicine, Chinese acupuncture high education, which is, if we compare to other courses, this is a very reasonable price. Finally, after the old graduates, after the complete old courses and pass the exams, you will award us the Diploma of Chinese Acupuncture. And of course, you will eligibly to join the Chinese Acupuncture and Herbal Medicine Alliance. Okay, sorry. Now let's move on. I will give my the presentation to our the program leader of herbal medicine, Dr. Tiejun Tang, to introduce the Chinese herbal medicine course. Dr. Tang, please.
Hi, hello everybody. Can you see my share screen, right? Is everybody can see the share screen?
Oh, not yet.
Yeah, it's coming on.
Not yet. Possibly the same problem happening again.
How about now?
Not yet. I just
Not yet.
Maybe try again.
about it.
Maybe try again. It was happened.
Okay. I think Tianjin should stop your share screen and I will share mine.
Huh? I think I've already stopped.
Have you?
Well, in that case, maybe Professor Wang, and you can help to share because it looks like your side is running much smoother.
Dr. Tang, could you stop sharing, finish sharing first, then try to share again? You prepared the screen. It's working. Could you try again?
Stop share.
Yeah.
Share screen.
No, I'm sorry. Have you opened the document on your screen first?
Yes, I did. Yeah. How about now?
No, unfortunately.
It's still
No.
moving.
No.
It shows start screen sharing, but not yet.
I think I might.
Maybe Dr. Wang do the slider for Dr. Tang.
Okay. How about now?
No, same problem.
Okay. I can just talk in without a screen. Yeah.
Okay, so could you stop your share screen? We can see the whole screen.
Stop share. Yeah. The signal in the clinic signal is very poor. Yeah.
Oh, yeah, maybe the signal is not great.
So Tianjun, have you got Tianjun's version? If you have your,
That's
his
fine.
copy.
Yeah. Well, Tianjun can share my that is for the lecture later. I can talk in just without the screen share.
Okay,
Yeah.
okay, you can talk first.
Okay. Welcome everybody, and I'm Tiejun Tang. First of all, I would like to talk about why we need to learn TCM. Yeah. So we have NHS in this country. Why we need to learn the alternative medicine, TCM. So NHS, you can see the doctor, it's free of charge. But why we need TCM? So that is because the modern medicine have too many problems, have too many difficulties to have to face. So like, for example, the metabolic syndrome. What is metabolic syndrome? I will talk in later in my lecture, 5 minutes, 10 minutes lecture. So that is hypertension, high blood sugar, and hyperlipidemia, and overweight, obesity. So if 4 of these happens in the same person at the same time, that is a metabolic syndrome. How to treat in this condition? So in the Western medicine, they need many tablets, chemical tablets. They need hypertension to reduce the blood pressure. Maybe is beta block, maybe calcium block, maybe ACEI, whatever. And also the patient need statin, which can reduce the cholesterol. And also maybe they need something for reduce the blood sugar, like metformin for diabetic. And also maybe doctor will give some aspirin as for the blood thinner. So many tablets, and maybe give some vitamin E, or some people, because taking so many medicines, the stomach discomfort. So some people have acid reflux. The doctor maybe prescribe some omeprazole. So add more and more tablets. So these tablets, each tablet has side effect. These side effects accumulate together, making a lot of trouble. You can't stop anyone. If you stop the blood padding, blood lipid, cholesterol will rise up. If you stop hypertension, the blood pressure will rise up. So you can't stop anyone. And secondly, drug resistance is a big problem. Like antibiotic get resistance. That is one of the biggest threat to the global health and food security and the development today. This is come from the website of WHO. So drug resistance is a big problem. In this condition, when the patient getting the treatment by antibiotic, first time it works well, the second time it less working. If third time doesn't work at all. So in this condition, that means the antibiotic get resistance. We need some nature antibiotic. So in this condition. And the third one, some Western medicine, they like chemotherapy in the cancer treatment and the radiotherapy. They can't recognize which is the cancer cell, which is the normal cell. They kill everything, causing a lot of side effects. The patient after chemo or radiotherapy, their red blood cell or white blood cell has significantly reduced. The doctor have to stop the chemo. If they continue the chemo, the patient may be died of incurable infection. But if they stop chemo, the patient may die of the cancer. So it's very difficult in the cancer treatment for some cancer. So Western medicine is a single target. Western, but Chinese medicine is a multiple target. It can treating the patient, treating the disease in several different ways, not only in one way. So that is the advantage of the Chinese medicine. Like Western medicine, like antibiotic A, they only treating bacteria A, target the bacteria A. Antibiotic B only target bacteria B. And antifungals only target to the fungal. And virus only target to the virus. But in Chinese medicine, a decoction have several different, maybe 10 or 20 ingredients. Each ingredient has several sub-ingredients. They boil them together, make it into a decoction. It can treat in many different kinds of virus, bacteria, and fungal, whatever. So that is treating more wide condition. And that is the advantage of TCM. Why we need to learn the TCM in LACA? I think TCM is a whole big conception. It including Chinese herbal medicine and acupuncture, and moxibustion and cupping, and the Tcm massage and qigong. So several different, all included in the TCM. And inside acupuncture, we have scalp acupuncture, electric acupuncture, ear acupuncture, and different kind of acupuncture. You can learn everything, every acupuncture, and herbal medicine, and massage, and moxibustion, and cupping, all you can learn in LACA. So why we need to learn so many things? Because if you only have acupuncture, that means you're only working with one leg. If you have acupuncture and herbal medicine, you are working with two legs. And if you have a moxibustion, you have a Tcm massage, you can run it fast. So that is why we need to learn Chinese medicine and acupuncture, Chinese herbal medicine, cupping, Tcm. We use all the technique together. It's better than single use. There's research. Unfortunately, I can't share this screen. This research showed that they use the research, they treating the arthritis. Arthritis index, they found they have three different groups. One group is treating by acupuncture only. The second group is treating with the Chinese herbs phenomenon. It's obstruct from the qingfeng teng, obstruction substance from the qingfeng teng. And the third group is compare qingfeng teng and acupuncture together. So after the treatment, it shows the herbs plus acupuncture is significant. The arthritic index is significant lower than other two groups. So this is published in the about 2 years ago, yeah, in the English magazine. You can read this. It's a very interesting research. So this research tells us a combination of herbs and acupuncture will have better effect than single-use herbs or acupuncture. So acupuncture, let's go back to nature. Acupuncture, Chinese medicine, is why we need to learn TCM, because it's safer, it's cheaper, it's more nature and more convenient. Because no side effects, of course, it's safer and cheaper. Maybe some people said in NHS, we don't need to spend any money, even more cheaper. But actually, sometimes some medicine is not covered by the NHS. And in some condition, if you go to the private hospital or GP, it's much expensive. And NHS, you can't get the, sometimes if you want to have a scan or and some appointment, you need long waiting list. Sometimes just because the diagnosis has been delayed and too late sometimes. So, and the TCM is more convenient and more nature. It's no chemical substance, no environment pollution. It's better for environment protection. So that is why I recommend TCM. let's go back to green. Let's protect the environment for our health. And as for the herbal medicine program in the LACA, we have, generally speaking, we have 3 modules. First module is TCM basic theory and the diagnosis in the first year. That's module 1. And second year is module 2. We introduce individual herbs and formulas. You will learn hundreds of individual herbs, maybe 300, over 300. And you will learn also 200 or 300 formulas, commonly used formulas. And at third year is module 3. We will introduce the management of the disease and conditions, how to treat in the internal disease, gynecologic disease, dermal disease, and pediatric disease. So in the different clinical conditions, how to use the herbal medicine to treat in this disease. So that is the third year. We have the module 3. But if for the new beginner, if you never learn Chinese medicine and you don't have any knowledge, we need to start from the module 1, spend 3 years. If for acupuncturists or if somebody already have some Chinese medicine basic knowledge, or already is an acupuncturist and practice acupuncture for many years, you can start from the second year. You can directly to learn herbs, formula, and clinical treatment. So that means only need 2 years. So from the beginner, maybe need 3 years. From the already acupuncture practitioner, or some other like massagist, massage therapist. So or somebody, if you already have some TCM knowledge, you don't need to learn from the start. You can start from the herbs and formula directly. So that is about Chinese herbal medicine program of the LACA. So next is have some question time. If anybody have any question, you can let me know. And also, if any question about acupuncture program, you also can put your question here, and Tianjun and me, we will answer your question. Okay, that's talking so many.
Okay.
Finished. Yeah.
So so Professor Wang, what is the next step?
Okay,
We're going
I
to
will
move on.
continue to share the screen for the courses. Okay, thank you, Dr. Tang, for your introduction. This is quite comprehensively introduction for the course, not only the course itself, but also the course, the study, the reason why we have these courses as well. That's great. Some reason. Okay, so now, is it clear? So, Dr. Tang, could you finish your share screen?
Yes. Can you see the screen?
It's still on your screen.
I stop share. Yeah.
Okay, that's good. That's good.
Okay, it's your turn.
Okay, so now, okay, because due to the technical reason, Dr. Tang's share screen not successful, so we just very quickly go through some of the herbal medicine key factors, such as the topics that we will covered for this course. As Dr. Tang mentioned, if you have already had, if you are already an acupuncturist, you do not need to study the first the year, the basic theory of traditional Chinese medicine. You will diagnosis directly to study the Chinese herbal medicine, formulas of Chinese medicine, treatment, etc. Yeah. This course will be in 2 years, and 100 to 20 hours per year, and 300 clinical hours, etc. Yeah. Okay, so we will move on. There are some, as we mentioned, we have some certificate courses of, first one is the certificate course of Tui La massage. This is the Tui La, it's a name in China, we call it Tui La, which is similar but not exactly the same as massage. We can call it medical massage or therapeutic practical massage. But in this course, we prefer to use the Chinese pinyin name Tui La. It's from Chinese manipulation therapy, often used conjunction with acupuncture. The basic course we will introduce some the basic acupuncture points, meridians, the basic Tui La manipulation, the treatment, etc. And also we will introduce basically infant Tui La manipulation and treatment. This is the Tui La course. This course is 1 year, 1 year only, and could be partly of the acupuncture course, or could be just a single certificate courses. All the graduate are eligible to join the CAHMA, which is the Chinese Acupuncture Herbal Medicine Alliance, to join as a Tui La member to practice Tui La practice. And in our courses, we have our next one is about our teaching clinic. First of all, our academy has its own student clinic on site, which will be in central London. This is operated on appointment only basis, run and full only for students. So as you can know, in this central clinic, all our key lectures will be running this clinic as the key supervisors. As you know, we are all lecturers and also practitioners. So we are all our supervisors. We all graduate from university in China with PhD degree, and also at least have 10 years of TCM practice in the UK. So that means you can, even from a student time, you can learn hands-on acupuncture, herbal medicine, Tui La massage, etc. With a senior practitioner in our central clinic. And also we have our we call the approved clinical mentors. That means not only in our central clinic, but also we are run our clinical mentor system. We will employ lots of senior TCM practitioners with highly experienced across the whole country, and with also they have a variety style of practice. So that means all the students, you can choose partly of clinical practice in your local area with your local practitioner, which will benefit for your future business, future practice. Yeah. This is our clinical supervisor system. And in terms of the accreditation for our academy, all our courses of the London Academy of Chinese Acupuncture, LACA, are fully accredited by the Chinese Acupuncture Herbal Medicine Alliance, which they call the CAHMA, which means all our students, you can eligibly and automatically join this association as a student member when you are in the academy, and also will be as a full member immediately after graduation. That means you can practice acupuncture, Chinese herbal medicine, or Tui La massage immediately after graduation. And also, as soon as we join this association, we can and we can buy the insurance as a group with a group price with this we call the holistic insurance services. In this insurance services, which will cover acupuncture, Chinese herb medicine, cupping, heat lamp, etc. All the forms of practice. And recently, we after discussion, we just published a new program, or you can say something like the certificate course we call the Apprenticeship with Tcm Master. This course will be available for existing practitioners to refresh your knowledge, to continue study, to improve skills, and also this course will be provide a tailored designed learning plan, such as you are interested with this handsome gentleman to practice the Meridian palpitation courses. You are straight away to learn with him in his busy clinic in Norwich, and also you may then very special techniques, very such as you can learn the herb medicine with our herbal master, Professor Dr. Tcm Master in central London, his Harley Street clinic. And also, you are if you are interested to study such as scalp acupuncture or electroacupuncture, you can come to learn with me in my clinic as well. So this is a very special designed apprenticeship Tcm Master program. You are more than welcome. Of course, this is a Chinese the version. As you know, there are some Chinese practitioners also interesting for this apprenticeship course we call the 师承班. So for the Chinese practitioners, you are also welcome to join this this special designed program. Okay, I think that's all for so far for our first part of our online open day. I think we can start our first question and answer session before our short presentation. Dr. Ye, could you holding this session for some Q&A session?
Okay, right. So we've got several questions some of the attendants raised. First of all, Anona was my ex-student from CMN. She was asking, can you tell us where we can find a study for arthritis?
Arthritis?
Yeah, so, I believe she's interested in treating arthritis. So is there any particular unit or special arrangement for people who's interested in a specific field of illnesses? Then they can learn more, advanced learning.
Okay.
Into that.
I think there are several several ways to study treatment for arthritis. First of all, of course, if you are already an acupuncture practitioner, you can join our Chinese herbal medicine course. As Dr. Tang mentioned, in our Chinese herbal medicine courses, there are some specific lectures to teach you how to use Chinese herbal medicine to treat arthritis. Yeah, this is one possible. But if you are not acupuncturist, you join our acupuncture course. In acupuncture course, we also teach use different style of acupuncture methods to treat arthritis. There are tools that, and also in the future, we may run some specific CPD courses to teach some specific subjects, such as arthritis. It may be one of the interesting CPD courses in our plan, in our future. And of course, we will run other specific courses for practitioners. We may integrate Chinese acupuncture, Chinese herb medicine in together to for practitioners to study. Thank you.
Okay, let me have let me give explanation about this question. And Arthritis is very common. It depends on what kind of arthritis. Most commonly is the rheumatoid arthritis, and also have some osteoarthritis, and also some arthritis is due to injury. Yeah. So at 2008, that is 12 years ago, more than 12 years ago, I was invited to deliver a lecture on the HMRA, RCHM. RCHM invited me to deliver a lecture on their CPD. The topic is how to treat in the rheumatoid arthritis with Chinese herbal medicine. So, and also I have published a paper in my blog in English, and also just talking about how to treat in the rheumatoid arthritis with the Chinese herbal medicine. You can Google this topic and put my name, you can read that paper. So many herbal medicine has a very good effect for arthritis, especially some unique herbs, which my tutor his experience, and it's very good effect. And as for acupuncture, also can help, but most acupuncture use local points mostly, as depend on which joint pain. Yes, if knee joints, around the knee, shoulder, and what kind of mostly. Yeah, that is TCM is very effective for rheumatoid arthritis and osteoarthritis and many arthritis. Yeah, hopefully I can give you answer. Any more question?
So there's Hong Qiao Zhou. She was asking a question. Someone lives in Scotland, is interested in learning acupuncture. Is it convenient for her to study this course?
Okay, I will answer this question. Yeah, first of all, to Hong Qiao, you are introduced some interest from Scotland to study to learning our course. Yes, my answer is yes. First of all, yes, our course is a blending learning. That means about half of our course are online teaching from the foundation of TCM. And even some of the acupuncture, the points, the channels, the basic theory, we can teach in, we say, through the online teaching. That's the first we say it is possible. And secondly, as you noticed, our clinical training, we provide this local mentor clinical. So that means the student, you can find some local senior acupuncturists or TCM doctors, which who are approved by of our academy. So we can accept the clinical training you provide, the mentor provide. So it is covered in the clinical hours. So that means that definitely more than we say 60% or 70% hours you can be done online or local practice. But of course, we request some hours, some teaching, some learning in our central class and the central clinic. That means only about 1/3 of your time will spend to our site. So I will say it is possible. And also our courses are running mostly in weekend. It is convenient for anyone to join this course and to look after their business, their family. Thank you.
Okay, that's all. I think that's all the questions so far we have.
I can see, I think 2 questions. I think a question from Mark Tang, ask about the apprenticeship. Oh, okay, I can see. So Mark, are you busy? I can see you are working today. You are working.
Yeah, that's right. Yeah, hi.
Yeah.
你好, thank you, Master. Thank you, teachers. Thank you, TJ, and thank you, Liu Zhong, as well. Thank you for everything. It's very good presentations as well. Now, I just want to ask regarding the apprenticeship program in terms of the length, enterprise certifications and part-time.
Okay.
Based in London, possibly.
Okay. Yeah. Okay.
Thank you.
Thank you, Mark.
Thank you.
First of all, yes, we are happy to see you. You were our previous student in CNN, and also happy to know you are still working as a doctor. You are a medical doctor. You are still working. I can see.
Yeah, that's right. So yeah,
and also join our program. Thank you for that, and thank you for your question. Yes, this program is a tailor-made program for existing practitioners. So they are quite flexible for part-time, as you say, the time learning. So that means we can tailor the design for this for this program for practitioners for you. So the length is mostly 1 year, and mostly in part-time, as you say. Most of the time is just 1 to 2 days per month, mostly in weekend. And the certificate is apprenticeship by the academy, and this apprenticeship will be acceptable by the CHMA. So you definitely have no problem. And also we can tailor the design the program for the applicants, such as if you're interested in, Dr. Tang mentioned, arthritis, we can design this course for arthritis for you. Or some people you are neurological interesting, so we can design neurological course for you as well. So there are some basic courses, and also they are mostly tailored designed courses.
So, so what? Talking about the flexibility, I think these could be have many ways, like the materials and the content of teaching can be all tailor-made. But also talking about clinical practice, I think you don't really have to travel a long way to your mentor's clinic. You can run your own clinic, and the mentor will be there for the day for instructions. So you run the clinic. Yeah, so I think that will be much more flexible in that way.
Great. Thank you. That's very helpful. Thank you.
Okay, thank you, Mark. Okay, I can see
thank you.
Gui Yan's iPad raised hand. So could you could you turn on your unmute yourself? Yes, what's your question?
Hi, Matt. I have a couple of questions. First of all, I just graduated last year from acupuncture college, and I'm actually is acupuncturist now. I'm interested in your herbal course.
Great.
So how many years, if I join your herbal course, how many years do I need to study? And how do you run the course? You just mentioned some of your course is online learning. And also about your clinical hours, you mentioned about regional support group something. So does that mean I don't need to go to London, go to the college? And another question is about the fee. How much will you charge?
Thank you, Dr. Tang. It's your question.
Okay. Okay, good question. Chinese herbal medicine program. Most of our course is online teaching. You don't need to travel to London, no matter how far you are. If you can get the Zoom, you can have the lecture. But not all the course is online. We still have some face-to-face course. But herbal medicine is different from acupuncture. Acupuncture, maybe you need to learn, the teacher will teach in hand by hand. But herbal medicine, we don't need so many. Master just learn online. So you don't need to travel here. But we arrange some, maybe just a few days, to maybe 1 or 2 days come and to recognize herbs. We will show you the sample of the herbs. You can get a little sample from each herbs. And maybe we need that also depend on the pandemic. If the pandemic finished, we can face-to-face teaching. We may arrange a few times, but you just travel just in the weekend, just 1 day. Most of we can see 90% of our class is online. As for the tuition fee, in our website, it shows it's 3,000 per year. Yeah. 3,000. As for clinic hours, you can come to our London teaching clinic. Also, you can find your local our teaching clinic. LACA have some local in many different cities, different part of the UK. We have some teaching clinic, and you can do the clinic placement in the teaching clinic, which is maybe not too far from you. Okay.
So how many years do I need to?
If you already have acupuncture experience, you have the basic theory of the Chinese medicine. We started from the herbs directly, just 2 years.
2 years.
2 years.
Thank you.
Yeah.
Thank you.
You're welcome.
Thank you, Dr. Tang. Let's move on. Next question. I will say how it's a.
Yeah, Anona's carry on. Continuous question for that, Anona. Thank you, Tianbi. You mentioned a medical study trial carried out in your introduction on arthritis. What is the reference for that? For this?
Yeah, I send this to you. You can check the chat. Press the chat.
Yeah. Thank you, Dr.
Anona.
Anona, yes. You can see. I sent you that reference already.
Okay. Thank you. Thank you. Next question is it's question, how about for practitioners, should time advise the class and we can see scalp acupuncture and using herbs in clinic? Okay, that's good. This is, thank you for the question. This is partly of our, we call the apprenticeship program. So this apprenticeship is, we say, a tailored designed course. So we will do the one by one, design these courses for individual request. So it is definitely, it is possible. So you can choose to join the whole program or partly to join the program. Such as you mentioned the scalp acupuncture. We will have scalp acupuncture CPD courses in the college, and also during our acupuncture certificate courses, we will also teach scalp acupuncture as well. That will be partly of the CPD training. So it's possible. And Dr. Tang, he mentioned also about using herbs in clinic. Could you answer this question?
Yeah. Yes.
The practitioners should time advise the class to use.
I think she means advanced class.
Oh yes.
That must be
arrange this. We can arrange this short time class. Yeah, like a CPD, like or focus on one system or some disease. We can have maybe just a few days teaching. Yeah, we can discuss in this. Yeah.
Okay, thank you, Dr. Tang, and thank you all the questions. So far, I think are they all the questions, Dr. Ye?
Yeah, it looks like so far that's all the questions.
Yeah, thank you. Yeah, it's a good time. Now it's about 8 o'clock. So if no more questions so far, we can move on to our second part of our open day. That means 5 short presentations by our key lecturers.
I put the reference I mentioned about arthritis treatment in the chat. Everybody can see this reference. Okay, it was published at June of 2018.
Yeah, thank you, Dr. Tang.
Yeah.
Okay, now, Dr. Ye, could you move on our second part of our open day about the presentation?
Okay, so now it's the second stage. All our 5 lecturers is going to give their own personal presentation, very short presentation, just to show their specialty. I think first one will be Tianjun, yeah?
So Dr. Tang first one.
My turn.
Yeah, hopefully. Oh, it's still not yet.
Can you share the screen for?
Okay, then let me. If you
screen?
Okay, if you can't, I received your the PPT on my system. Let me try. Could you finish your share? Let me try. Dr. Tang.
Okay, yeah,
stop.
sure.
Okay, okay, you stop now. Let me try if I can find your. Okay, here, here. Is this one, Dr. Tang?
Yes, yes, exactly, yeah.
Okay, this one, yeah, this one I received on my system, so you can.
Okay, I just talk in a few minutes, and the topic is the metabolic syndrome and its TCM food therapy. Next.
Oh, sorry, not move. Oh, sorry. Yeah, that's it.
Okay, like we mentioned, if metabolic syndrome, the patient often need to take many tablets, hypertension, which to reduce blood pressure, and statin, and for cholesterol, and this anti-diabetic drugs, metformin, something, and aspirin, and omeprazole, and vitamin, whatever. Okay, many tablets they need to take it every day, so they can't stop, maybe whole life. So each tablet causes side effect, and that and accumulation of the multiple side effects causing a lot of trouble. Okay, next one. Should have another one in between.
Oh, sure. No.
Oh, directly come here, right?
Let me. Yeah, this one direct come here. Yeah.
All right. 枸杞菊花茶. Goji berry is a Chinese herbs. We can say it is a herbs, but actually it's just like a food supplement. You see this is in the red color, that is goji berry. And juhua is this yellow flower called juhua. We put goji 10 grams, add 500 milliliter water, boil 2 minutes, and add juhua 10 grams or green tea 5 grams, covered or soaked for 30 minutes, drinking once or twice daily. Once or twice, it doesn't matter. Yeah. Just like drinking Chinese tea, just like you make a cup of Chinese tea. So simple and easy. Next one. So, Goji Juhua Cha, the function of this tea is tonify the liver and the kidney, nourishing the blood, and moistening the yin, soothing the liver and detoxificating, and benefit vision. Goji berry has the function of benefit the vision because it tonifies the liver and the kidney. In Chinese medicine, we believe eyes is the out opening of the liver. So if it benefits the liver, also benefit the eyes, so benefit the vision. So that is important function of Goji Juhua Cha. And in the clinic, it can treat in many conditions. Yeah, please show next one. So clinic application is hypertension. Of course, it's the early stage of hypertension. If the blood pressure is too high, it's very high, we have to use the Western medicine, to be honest. We can't say, okay, you don't need to take Western medicine, only take this. No, that is wrong. Yeah. But early stage, actually quite a lot of people, the blood pressure just around borderline. It's not very high. The low pressure is 95 or 90, 95, and the high pressure maybe 140, 100, around 140. So it's not very high. We can use, we don't need to use the hypertension. We just use the Goji Juhua Cha. It's okay. And also atherosclerosis. Atherosclerosis is so common. Many people after the age of over 60, more or less, have some atherosclerosis. It is a risk factor of the coronary heart disease. For this Goji Juhua Cha, this tea can prevent atherosclerosis. And the third one, just coronary heart disease. This coronary heart disease can have many different types, but this is a mild type, just have angina, or some have often have chest pain or tightness chest. If the people already have heart failure, it's not suitable. Yeah, we only or myocardial infarction, yeah, also not suitable. Only treating the early stage of coronary heart disease at the angina. And the third is diabetic. So usually it's type 2 diabetes. Type 1, maybe they need insulin, but type 2 diabetes also is sugar level is not very high. We don't always need metformin, some chemical tablets. So枸杞菊花茶, this tea can help to reduce the blood sugar. And hyperlipidemia means cholesterol high. So also we can use this one to reduce cholesterol. And dry eyes and blurred vision. So nowadays, many people use computer or mobile phone or use to see the screen too often. So many have some vision problem and dry eyes. So if no matter what kind of age, even young person, yeah, if you see the screen many hours, have dry eyes, try this. 枸杞菊花茶. And next food therapy formula is 玉米须汤. 玉米须 means corn sick, like this, corn sick. And how to prepare? There are 3 different ways. Number 1 is just use 玉米须 washed and soaked with the boiled water, and then soaked 5 minutes, and then you can drink in the tea directly. Second way is wash the 玉米须 and boil it for 5 minutes. First one is more simple one, just soaked with the boiled water. You don't need to boil the 玉米须. The second one, you need to spend 5 minutes to boil the 玉米须 with the water. And the third one is boil the corn with 玉米须 together, eating the corn and drinking the soup. So that is, you get a fresh 玉米须. 玉米须. And 玉米须, you can get it in any Chinese herbal medicine shop, or if that is dry one, it's not fresh one. Dry 玉米须, it's the same. If in the summer you can get some fresh 玉米须, that will be better. Okay, next one. What is the function of 玉米须 corn sick? Next slide. 玉米须, the function is reduce blood sugar, promoting the urination and subset jaundice, reduce blood pressure, and increase immune function and anti-cancer, inhibit cancers. So you see, so many functions. It's good for metabolic syndrome if they have blood pressure a little high and blood sugar high and high cholesterol. So you should help. So especially we put at the top, especially for reduced blood sugar. This has been approved by many scientific research. Because time is limited, we don't need, I don't have time to show you the reference paper. So 玉米须 definitely can, the mechanism of the 玉米须 is to reduce the blood sugar is clear. About 3 years ago, I delivered a lecture in the Argentina, Buenos Aires, Argentina, just talking this topic in the international conference, International Chinese Medicine Conference. So I can talk in this for half an hour. Yeah. Next is 菊花茶. 菊怀茶, sorry, 菊怀茶. 菊 mean 菊花, 怀 mean 槐花. 花 in Chinese means flower. Two kinds of flower. 菊花 3 grams, 槐花 3 grams. Green tea 3 grams. Each ingredients 3 grams. Put them together in the cup and add boiled water. Soak for 5 minutes. Drinking the tea once or twice a day. So simple and easy, right? Green tea. If you don't have green tea, you have some other tea, it's fine, but green tea is better. So just 菊花 and 槐花. So next slide, please. Cha, the clinical application is hypertension. 菊花 with goji berry, that is goji 菊花茶. At the beginning, the first formula is goji 菊花茶, the same things. But if the not with goji berry, 菊花 with the 槐花, also good, suitable for hypertension. Except hypertension, also for headache and dizziness. Actually, dizziness and headache is a common symptoms of hypertension. Some people, some hypertension patients with the symptoms, headache or dizzy. Some maybe no symptoms, but only blood pressure high. So no matter which condition, 菊怀茶 is a good choice. I strongly recommend use 菊花 and 槐花, only 2 flowers, put them in the cup and add some green tea, add boiled water. So you can, it can benefit your blood pressure. So maybe you don't need hypertension. You don't need to, you can avoid these side effects. Next slide. This is the last one.
Yeah, looks like the last one.
Okay, good. And you know, I introduced 3 herbal formula, which is not you don't need to like to boil the herb decoction. Some people, they don't like to take Chinese herbal decoction because it tastes not nice. It's a little bitter taste. But this food therapy, the taste is nice, good taste. Taste not very horrible. Yeah, good taste, and also simple and easy. So for metabolic syndrome, if you take the Western tablets, you need to take it every day. And if you take the herb decoction, also very difficult for any people to take it every day. But every day you need to drink a cup of tea, just like you drink a cup of coffee. Use these 3 formulas to replace your coffee, and you can make your sugar, cholesterol, and blood pressure under control. Yeah. Remember, only suitable for mild case. If severe case, you still need to take the Western medicine. But if you take either these food therapy, you can reduce the doses of the Western medicine. If you reduce the doses, of course, the side effects also reduced. So if, for example, before you need 2 tablets to control your blood pressure, but after you take this herb tea, you only need 1 tablet. So the side effect is significantly reduced, or even no side effect happen. Okay, that's what I need to comment. Okay.
Okay.
Good. Finished. Next, I come to Tianjun. Yeah.
Okay.
Thank you. Thank you for your attention.
Okay. Thank you for Dr. Tang. Next one will be Dr. Liu Zhongye. Will you share yourself, Dr.
Okay. Yeah, I'm going to share myself.
Yourself. Okay. Thank you.
Okay. So, right. So, I have to be enabled to do the screen sharing.
You're not?
I need authorization.
Oh, so strange.
Because
I think it is okay. Okay, so it should be now. Should be okay now.
okay, so all right. Okay, so first of all, I think not everyone knows about me, so I'll just give everyone a brief introduction about myself. I come from China. I had my PhD, master degree, all achieved in Guangzhou University of Tcm, but I had my university degree in Beijing. So both of the university are the prime prestigious university in Tcm field. So after that, I moved to work in the UK since 2003. And my personal background is I married a Japanese lady. We're cooking at home, a fusion of Chinese and Japanese cooking, and also English also. So we can use chopsticks to in one dinner we have sushi and Chinese soup and also pasta. We can mix them together. So this is the fusion quite a lot often you can see in my family life. But however, in my practice, my TCM practice, I have a fusion style of practice. I fuse my background. I completely came from a herbal training background because all my master degree was doing like internal medicine with digestive disorder, and PhD degree was doing the Jingfang Jingui Yao Rue with arthritis, so rheumatology illnesses, all herbal backgrounds. However, I am now in my own practice. I am a specialist with the meridian palpations and acupuncture. So, and then I'll use my knowledge of herbal medicines and internal medicines, and with my practice with using acupuncture and meridian diagnosis. So this is what I'm going to talk about tonight: a fusion, a good blending of meridians, acupuncture, and herbal medicine. How you can mix them together and make the effectiveness of your treatment achieve the best effect from your practice. So this is the topic: a smart approach, bridging meridian, symptoms, herbal formulation. I think this is the modern challenge of TCM practice nowadays, especially since the pandemic time. COVID pandemic has raised a big challenge to most of TCM practitioners. Herbal remedy had played a big role in helping. In helping with people, but chances exist along with crisis, because with a typical conventional TCM practitioner, you need to see the patient's tongue, you need to check their pulse, and you need to ask a lot of questions to be able to come to a precise differentiation and then give you a proper formula for the patient. Because during the lockdown, there's no face-to-face treatment, so there's no chance for you to do acupuncture treatment, to do any body touching, any type of that therapies and treatments. The herbal medicine can play a part in here. However, that's a limit. If you don't have a good approach to the patient's tongue and not mentioning the pulses, it would be really totally relying on the symptoms. And then you found the precision of your diagnosis becomes very limited. So this is how my style of practice come to life and bring the maximum effect of the treatment. So this is what I say: the symptom-based differential diagnosis has its limitations. So it has to be relying on the patient to give you as much information as possible. Also, because this telephone, either the telephone or social media conversations, the communication has time, spending, time consuming, side effects. So then you will find, you might not be coming up because you're not face to face. You might not be able to get in a short turn of conversation. You might not be able to really get as much information as you can. Also, the tongue and pulse, as I said, if the tongue is not taking in proper lighting and also the duration of time to take the photos are not quick enough, the tongue look will be confusing and sometimes can be distracting. Obviously, there's no chance to take a pulse. So that is the limitation of the modern TCM practice during this time. I think because as the COVID pandemic goes on, and the style of practices might still carry on for quite a long time. So then that might affect the future style of practice of TCM, or including the mainstream medicines, like your GPs are not seeing you anymore face to face. Most of your consultation with a GP is already telephone consultations. I just give you a case. Give you just a case study to give you a quick example how my style of the treatment started to build up into these to build into those modern demands of practice. So this is a COVID infection patient, and the patient started to have very severe chest pain, and he sent a text to say, "Oh, there's a massive pain in front of my chest, which catches me when I cough." So so the pain is there, the time. You are not next to the patient. You cannot really sort of give any treatment, like hands-on treatment for them. What can you do? Even like talking about herbal treatment, you can't really send herb, in a second, just show it, present it next to him in a second. So my style, acupuncture, and mixed into the meridian palpation is, we find the most sensitive points on the relevant meridian that could be related to the pain, related to the major symptoms of patients, and ask them to do the massage on that. And immediately they had a good release from this massage. So after a while, the patient report back to me, say the pain has abated. I feel a lot better on the 150 of each. So that means just 150 circles on the point. So that the release of the pain and release of the symptom can be as quick as just within several minutes. 150 circle means less than 3 minutes. Here's another patient. So that was a meridian, but now this is the herbal treatment more. And this is a dentist in my city, and she contacted me for the symptom very close to COVID. Obviously, she said she got tested that was negative. However, she was experiencing all the symptoms that you expected to be on a COVID infection. So that includes those extremely tired, sickness, diarrhea, and all the symptoms. So again, I was using my own style of meridian palpation, asked her to test the point, and she gave me several points, and that feels very sensitive. And then I advised her to do those points. Oops. And then with her reporting back on those points, sensitivities, I was able to give a formula based on what we learn from reading and analyzing all those meridian sensitivities. Here is the formula I gave to her. This is about a 10-day supplies of 5-gram powder twice daily, that dose. And then she sent me the next day, she received the powder and started to have powder because it's in the same city. So her husband came to pick up from my practice, and then she started to have that powder straight away on the same day. And then she reported back to me the night she took the first dose. She had all those, extreme symptoms that what we call healing symptom or detox symptoms. And she felt so much better the next day morning. So she texted me. So then this is what we're trying to say. sorry, this is too sensitive. This is what I say. When you had two tools, the herbal medicine knowledge and your acupuncture and meridian knowledge, you can mix them together, make your own style, and then they actually greatly enable you to do more flexibly with different patients and different cases. So meridian point sensitivity can be quantified and therefore apply as a method to achieve higher precision on diagnosis. And also my style, also we emphasizing the yin and yang nature. This is all totally coming from the Chinese medicine, the core of traditional Chinese medicine philosophy. Yin yang nature of meridian points on each side of the body help with classification on cold, heat, exercise, efficiencies of conditions. And for solution of many complicated and lack of clue conditions, the meridian symptom formulation approach is a golden key. That means, for some very strange symptoms that you haven't got a clue how to do with that, you can actually explore, start with the exploration on the meridians. Usually meridians is an honest, keeper of all the secret of the body. So you can so disclose a secret book of what's going on in the body, and then you can start to work on that according to those readings of the meridians. That's how I deal with many of those cases that generally people, we will give people like headaches and you scratch your hand, you can't, we don't, for some of lack of experience practitioners, it might be a difficult case, but then this will enable them to learn much, to get to achieve much more higher success in their treatment. And in LACA, through proper training, all of us are able to gain the skills to provide a much higher efficacy in treatment for clients. So, the two cases just now I gave you was just a very simple cases to show you how we can do together. So if you are coming from an acupuncture background, training background, you're welcome to join us at herbal background. If you already had your herbal certificate, you're welcome to join our acupuncture background. So we can give you both and help you to develop into a more advanced style of practice. And so in LACA, we have the facility to blend all the methods into solid knowledge and skills for our students. To end today's talk, I'll give you another quick case. Oops. So dandruff. This is one of the patients come to me for dandruff. Obviously, this is also during the lockdown time. No chance to meet him face to face. No chance to take a pulse. So what we did, actually just help her to get through all this meridian track and read through the meridian, and we get an idea what's going on in that for the dandruff. He's had for many years, as long as he can remember. So this is this is a young man in his late 20s or early 30s. So about 3 weeks of medication, herbal medicine I sent over. And that was, the result of the medication. The dandruff's cleared. So that he was happy. And then for many of these, because I am not like a dermatology background training, I don't have much of a very profound trainings and experience in treating this, but I am still able to treat cases like this. Sometimes it totally like, no clue what can we do. Sometimes we say, oh, this dandruff is not okay, it's not a problem, you should treat it. But for those people who's very much into, they're very care about their image, that still can be a problem, and you have a solution for it. So this is, I give everyone, and especially for those young practitioners, when you start your journey of TCM practice, I think LACA can provide a much better chance for you to promote your own skills and knowledge and your confidence to face your future career. Okay, thank you for listening to me, and I look forward to seeing you at the college, at the LACA Academy. Thank you.
Okay, thank you, Dr. Ye. Could you end your slideshow? Okay, thank you. Okay, let's move on. Next speaker is Dr. Yonggang Han. Could you share your screen first, yourself?
Okay, let me find out. Okay, I can't find it on the. Dr. Wang, can you do the slide for me, please, if it's possible?
Okay.
Yeah.
I tried to go for that one for you. Just hold on. Yeah. I should have one on my system. I can't find your one. I will see. It's so strange. Okay, got it. Can you see?
Yeah.
Okay, so
Yeah,
go ahead.
maybe show the first page for me, please.
First page?
Yeah.
Yeah, this is the first page.
Okay, yeah. Let me introduce myself first. My name is Yonggang Han. You can call me Gavin or just call me Han. It's easier. I began my medical career in Beijing Muslim Hospital in 1995. And then I gained my PhD on TCM from China Academy of Chinese Medical Science in 2008. And then I came to the UK 2009 and worked as the medical director for China Healthcare Group. And then I started working at the dry clinic in 130 Harley Street since 2015. I started my own practice in holistic health clinic and Chelsea Natural Healthcare in 2018. I'm very happy for joining the team of London Academy of Chinese Acupuncture. Today, I'd like to show you
Music.
What happened?
Sorry.
What?
Is any music in your slide?
I'm not sure what happened.
Let me try again.
Maybe you got my PhD edition for.
Let's see use one. It's okay. It looks okay. So go ahead. Some reason, yeah.
Yeah.
You go ahead,
maybe
please.
not the full screen. I think this one would be better.
Okay, we do not use the full screen, so just in case. Yeah, go ahead.
Yeah. Okay, today I'd like to show you the 五行诀 5 elements, Chinese herbal medicine and acupuncture. Yeah, the first part. Next page, please. Yeah, the first part is 桃红景 and 五行诀. Next page. It's well known the 五行诀 was written by Tao Hongjing in 500 AD. Next page, please. Yeah, I show you this book. This is the first monograph of 五行诀, which is published in 2008. Now, more and more doctors have begun to research and practice 五行诀 in recent 10 years. Next, please. So, next step, I will show you the incense herbs of 5 elements. Next page, please. Yeah, that's the 25 essence herbs of 5 elements. Tao Hongjing chose the most common used prescription from 365 formula in Tang Ye Jing to write the 五行诀 Unfortunately, there are only 52 prescriptions left now, and Tao Hongjing carefully selected 66 herbs from thousands of Chinese medicine herbs, which is called essence herbs of 5 elements. Next, please. Yeah. And next, I'd like to show you a very important photo. As a fans of research of Chinese culture, you may know the photo. The first is Tai Ji, and then is a He Tu. The third one is Luo Shu. Yeah, but what I would like to show you today is the fourth picture is called the 5-element diagram. Yeah, the full name of the mean the 5 elements constitutions, functions, nourishing and reducting diagram. It combines the 3 pictures of Tai Ji, He Tu, and Luo Shu into one picture, as this picture has the rules of formulating traditional Chinese medicine prescription. Yeah, the third one. Yeah. The original book, Fu Xing Jue, combined the 60 formula, but now it's only 52 left. So all 52 formulas were from Tang Ye Jing and are all classical prescriptions. These prescriptions are also commonly used prescriptions and carefully selected by Tao Hongjing from 365 formula. It is possible to cope with various diseases using this 52 prescription rationally and flexibly in clinical practice. So compare the huge prescription of 20 or even more than 3 ingredients by many modern Chinese medicine practitioner. Fu Xingjue's formula have few components and are more refined. Take 24 formula from nourish and reducing 5 elements as an example. 3 ingredients for small reducing formula, only 4 ingredients for small nourishing formula, 6 ingredients for large reducing formula, and only 7 ingredients for large nourishing formula. And the small formula focus on major organ, and the large formula take care of parental organs. So therefore, the formula from Fu Xingjue can be called precise prescription, and the precision medicine begin at Fu Xingjue. That is the wisdom of ancient Chinese. So, based on the TCM therapy of similar entropy, response or interact, and the harmony. Next page, please. Harmony of acupuncture and herbal medicine. I transform that the 24 herbal formula for nourishing and reducing into 24 acupuncture for nourishing and reducing, as shown in the table below. The next page, please. Yeah, that's the 24 acupuncture for nourishing and reducing. Yeah, if we talk about the value of Fu Xingjue, is equally important as 4 major classic recognized by modern Chinese medicine, 黄帝内经、难经、神农本草经, and伤寒论. It's the 5th class book of Chinese medicine. So the last page, yeah. If you are willing to learn, welcome to join the London Academy of Chinese Acupuncture. Let's learn and practice the 5th classic of Chinese medicine together. Thank you.
Okay, thank you, Dr.
Yeah, finished.
Yeah,
Dr. Wang.
Dr. Han. Next presentation is Dr. She. Dr. She Jun, are you ready? Yeah, please unmute yourself.
Dr. Sir, you need to unmute yourself.
Sorry.
Hello?
Yes.
Yeah, just hold on. Yeah, hold on. I will. What's happened? Yeah, you can introduce yourself first, Dr. She.
Okay, so welcome to LACA Online Open Day. My name is She Xiaojun. I came from China. I came to UK 2008 after I got my PhD degree in China. After I came to UK, I'm a lecturer in one of the university for almost 6 years. So now I have over 10 years teaching experience in Chinese medicine. Today, I'd like to share one of the methods. It's a 6 Meridian method. I think most of the people know the 5 elements theory. 6 Meridian method has a close relationship with the 5 elements. It's originally derived from Shang Han Lun, written by Zhang Zhongjing in Han Donghan Dynasty. So 6 Meridian method is very popular. So Chinese medicine, we see patients, we do diagnosis, we use 6 Meridian method. So if just talk here, like here, so you still don't understand, 6 Meridian method, what's it for? Next page. Next one. Okay, here, look at the picture. There is a 6 levels. So first one, Taiyang, second, Shaoyang, third one, Yangming, and the Taiyin, Shaoyin, 6 levels. We see patients, we make pattern differentiation, we use the 6 levels. For example, I give example, like a fever. For example, if people have a fever, for example, common cold, people have an alternative, people have a original cold with a fever, we treat Taiyang, the first level. If people got common cold, but his symptoms is alternative attack, feeling hot and cold, we treat the second level, with Shaoyang level. If people have a very high fever, for example, like pneumonia, so we treat the third level, is called the Yangming level. And also some people have a fever, but after check out everything, people cannot find what's wrong in examination and a test. So one of the reason is the fever from Taiyin level. In Chinese medicine, we say spleen deficiency. People still can get other kind of a fever. For example, during the menopause, the female have the fever, especially have a fever at night. This kind of a fever, and also sometimes it gets sweated. We like to treat the 5th level, and the last level we say Juyin level. For example, people still have a fever, but this kind of a fever, this is different. The patient can feel, he has or he had a fever, but when other people touch the body and he has no fever. So we will treat the last level, the 6th level. So even for one fever, we use a 6 Meridian method to do the pattern differentiation. And also 6 meridians has close relationship with the body. For example, we say 太阳. 太阳 is on the top. People suffer from the common cold. Very common for most of the people. The first symptoms, people have a headache. So we say 太阳. The second, is a 少阳. Some people suffer from the common cold. They have a sore throat. So we say the 少阳 problem. And also, next level, we say 阳明 problem. People have for example, people have a nausea or reflex of the acid. So we treat the third level. And also, 太阴 level is just have a look. Look at that area. That area just the small intestine area. So people suffer from the diarrhea. So we like to treat the 太阴 level, or digestion is the problem. And 少阴 problem. 少阴 problem for look at over there. Some people during the menopause, they have a flush, hot flush. So a flush originally for the 少阴 level, some kind of a flash. It's just coming below the belly button, just from the 少阴 level, and also 厥阴 level. 厥阴 level is the lowest part of the body. If something's wrong there, we'd like to treat over there. For example, like some kind of a reproductive system problem. So this is related with the body up and down. And also from the back to the front, we still use the 6 Meridian method. I think if you have a Chinese medicine background, we know the people have 12 meridians. 12 meridians is still derived from 6 meridians. For example, like a back. We mentioned, just look at the picture. The first one is 太阳. 太阳 is on the back. So next page. We say 少阳 is on the side, just like in the the mobile. The side of the mobile is the boundary from the back to the front. So this is the 少阳. 少阳 is on the side, just like when we turn the the paper, when we open the door, when we close the door, just the pivot. And also other meridians, because the 太阳 we say is a young meridian, and the 少阳 we say just like the axis of the door. Yeah, 少阳 just like the axis. All other meridians on the front, we say all other meridians is the yin meridians. So if you look at these kind of meridians, 12 meridians, so they're all applied. So we use these kind of theories, not only theory, because we use acupuncture, we use herbs, we use massage, we all based on these 6 meridian methods to do the pattern differentiation. So this is my sharing, and we'll come to LACA again if you're interested in Chinese medicine to learn Chinese medicine. 5 elements, 6 meridian method. That's it. Thank you very much. Thank you. Thank you for listening.
Okay. Thank you for Dr. She's presentation about the 6 meridians. The last one with myself to a short presentation. Today it's quite late now. So I will very quickly go through my presentation to introduce the topic TCM brain theory from Eastern to Western. Yeah. In overall about TCM brain theory, as you know, in basic TCM theory, brain is only one of the extraordinary organs and very few discussed and practice. Actually, if we go through our TCM classic, there were some statement in Huangdi Leiji already. Very few study on the physiology, pathology, pattern, etc. From 1980s, there are lots of progress and developing on the theory of clinical research on brain in China, particularly on acupuncture practice and research. The foundation of TCM brain theory was established from the book 2007 called TCM Brain Science. Yeah, very quickly we'll see. Originally in TCM, in Huangdi Leiji time, there are already the arguments about the brain, such as Huangdi asked, I've heard different comments from different physicians. Some take the brain as a zang organ, some take it as a fu. Yeah. Also, there are lots of other statements in Huangdi Li Jing time in the TCM. And from the TCM brain theory, and they call the brain is the sea of marrow. It transfers. The upper part is the upper joint, upper region at the top of the scale, and the below Feng Fu 216. So 216 is the channel of Du Mai go inside of the brain. So as you know, for the classic 12 Zangfu organs have its affiliate channels and transfer the qi and the blood, collect the Zangfu, associate the external with internal, as well as at the part lower. But what about the brain? After lots of research in China, in myself as well, we believe the governor vessel or Du Mai is the channel of the brain. The function of the brain we can summary as to dominate the life, such as the consciousness, to operate the physical activities, including vision, hearing, all factors, taste, sound, and also the brain to govern the mental activities, including memory, sleep, intelligence as well. And so far, unfortunately, there is no any textbook systematically explained the pattern of brain. So during my research, I summarized the commonly clinical patterns of brain and its possible symptoms. But of course, they are still very early stage. They are undeveloping. In the last about 15 years after my study of the TCM acupuncture brain from my PhD, I published some papers. And also recently, in the last 10 years, I published several papers in English journals to introduce the TCM brain theory. The most importantly, recently, last year, I published a book, some colleagues realized, the book we call the Acupuncture for Brain, Treatment of Neurological and Psychological Disorders. This book systematically introduced the acupuncture TCM brain theory, including the theory, techniques, and the treatment of brain disorders. If we say the TCM brain disorders, including the theories and the techniques of brain, unique acupuncture techniques for brain conditions, including scalp acupuncture, Dao Qi technique, and awake the brain and open orificals. All this very, very briefly give you an idea about the scalp acupuncture. We use the same terminology with the neurological theory, which is very, very common language in the Western countries, for not only for Western the academics, but also Western people. They are easy to understand, such as we say, if we say someone suffering from mental problem, we use the spirit emotion area. Someone suffering from the speech problem, we use the speech area, etc. This is commonly understanding. And also, you know, for the scalp acupuncture meditations, they are very, very unique as well. So, and also we know the brain related diseases, including neurological diseases, mental illness, and other brain related diseases as well. So all these theories, all these techniques will be introduced in our courses in LACA, London Academy of Chinese Medicine. So you are more than welcome to join our course to deeply understanding the TCM brain theory and its techniques. Okay, that's all. A very briefly introduction about the brain theory. Dr. Liu Dongye, let's move on for the questions now. Dr. Ye, please unmute yourself. Dr. Ye, please unmute yourself.
Yeah, sorry, I forgot to unmute myself. Yeah, we have some questions regarding the earlier part as well. Let's just starting from the beginning. Okay, so we have a question. So combined treatment with some xenomantine and oh no, this is the that is the quotings. How can I find a CPD training? So this is the first question. Gui Yan.
I would say the CPD training, we recently just have some, we can say some plan, some idea with some topics, but the detail will be soon published on our website. But it's just often review our website, and also we will publish all these courses on our Facebook and mailing system. If you are interested with any subject, you can email to our college email box to understand more detail. Definitely, they are soon published on our website.
Okay.
Yes.
Second question is, what's the length of a apprenticeship program and the fees, or is the difference between this program and the main course? So. Oh
yes, this is definitely different. The main course, such as acupuncture, there will be 3 years in detail introduced from foundation background to the detail. 3 years. Herbal medicine will be 2 to 3 years, but apprenticeship will mostly in 1 year. And also this apprenticeship will the main course will be, it's a set course, something like the set menu. You have no choice which lecture, which subject, etc. But apprenticeship is something more, something like we say like a buffet. You can choose the interesting subject yourself. Will be finished in 1 year. It's much more easier finish, and also you can choose the subject and your master, your mentor, for your interest. So they are more flexible and more designed course.
So one more thing I want to add is the main course. The main course is actually for foundation. So that means for somebody who doesn't have a basic knowledge about acupuncture or herbs, so you want to do you want to do a proper solid foundation building, then so you need to go to the main course. And for those people who choose to go for those apprenticeship program, it's not for these the basic. This is for people who's already had some experience, but they want to improve their understanding and to speed up their experience and to learn a specific field of a particular specialty. Then they choose a special mentors and master to follow and get better learning from the masters.
Yeah, that's great. Thank you. We move on. Any other questions?
Okay, so is Chinese herbal medicine using same international herbs name?
Oh, this will be Dr. Tang.
Well, I think.
Hi, hello. Yes, I'm here. Yeah.
Okay, go ahead.
I'm on my way. Yeah. Yes, when we teach in the Chinese herbs, individual Chinese herbs, we will introduce Chinese name in pinyin and also Latin name, English name. You can we will introduce everything. Yeah. You can, but mainly we based on just the Chinese pinyin. But same time, you can get Latin name. Every herbs you will get the Latin name. You can find the original from some dictionary and from search on every dictionary. Yeah.
Okay. So next question: there are some Chinese herbs are not allowed to use in the UK. How do you deal with situation with the Jingfang?
Okay.
Oh yes, very good question. Yes. That is the part of our teaching plan. We will introduce which herbs is allowed to use and which is forbidden by the law of the EU country and the UK. Yeah, of course, animal substance are not allowed to use, and some herbs have a little strong toxic. and also has been banned, and also some endangered species, endangered animal or endangered plants, so also are not allowed to use. So we will introduce this kind of part of knowledge about the law, about the herbal law in the EU country and the UK. Yeah, we will find some to replace. Which herbs to replace? If we can't use that one, we can find some replacement. Yeah.
Okay. So one last question: how students are being assessed if they have achieved a competent standard?
Yes, I would say we have, of course, a standard assessment, which will be aligned the similar level with other UK higher education on TCM, acupuncture, and herbal medicine. Definitely, each module we will have, we say, the module specification to clearly introduce what's the assessment method in each module. We will have the the paper assessment. We say some we say the essay writing, and mostly we will more focus on the clinical practice, whatever acupuncture point location techniques and the clinical treatment plan, etc. So definitely we have our the assessment system, which will be published on the student handbook, and in the future we will publish on our website as well before you start your learning. Yeah, definitely we have our the higher education assessment. Thank you.
Okay, so I think this is so far the last one we have.
Yes, I think so. So far, that's the questions. Any other questions? There's some free time for free questions. You just raise your hand, or you just unmute yourself. Or other lecturers, Dr. Han, Dr. She, do you have any comments on these questions, or any other final comments?
Not now.
Oh, no, okay, don't worry. Mark Tang, raise your hand. Yeah, go ahead, please.
What's the price again for the apprentice program again? The apprenticeship.
Apprenticeship is £3,000 a year, I think.
Okay. All right.
Yeah, yes.
That's it. Thank you.
It's a 1-year program with £3,000.
Yeah.
Okay. Thank you.
So about the Chinese herbal course, I think I want to add, because I was teaching in CMN, and CMN is the College of Naturopathic Medicine. They also have herbal courses in there. However, this is mainly a Western herbs based. So they are talk about mainly on these herbs energetic effect. But what is the difference that make our college stands out is we're combined herbology as well as the formulations. So we have also the TCM essence in here. So we need to really teach people with not only just learning individual herb ingredients, we also learn the full package of the formulation, the ideas and all that. And especially when you have the a good combination of those 6 channels, I mean, 6经 or the Meridian palpation method together, and you'll find yourself much more flexible and also much more profound understanding about those formulations and herbs practice.
Okay.
Okay, so somebody also raised some questions here.
Questions. Okay.
Let me just check. I can't really see.
Okay, I can see from Liu Chuyan asked, will LACA provide master and PhD courses? Okay, thank you, Dr. Liu, for your question. It is on our plan. It's we will say something like a 2 to 3 years plan. The moment we are more focused on our something like bachelor level, but in the future, yes, we may have some master and PhD courses in the future. And that's my answer so far. The last question I can see, can we apply if we don't have a level 3 certificate of alignment? Yes, the answer is yes. That means the certificate for the anatomy and the physiology it's compulsory until you graduate. That means when you apply this course, it is not compulsory. So you can start the course, but during this 3 years time, you are asked to apply this kind of courses and whatever. There are lots of this kind of courses you can find in anywhere. They are very easy to find. And in the future, maybe we will provide this course in our college as well. But as my understanding, if we provide this course in our college academy, they are expensive than outside. So you can find, I searched, there are lots of colleges provide this kind of courses with, I think, roughly about several £100 for this course. They are more reasonable. So I would suggest that you can find some courses outside, external. So it is yes, the answer is yes, you can apply. Okay, from Jenny. Okay, thank you. Thank you very much. Okay, so it's now already after 9 o'clock. So Dr. Ye, so back to you. If you know any more questions, we can the final speech.
So I think that's the last call for questions. If nobody wanted to ask questions, either the typing or raise your hand, and we should finish today's. Oh, so there's one more people. A name as B. Can I double check that there's no minimum requirement to sign to join? Can I double check there is no minimum requirement to join this course? I think that's what she.
On my understanding is if this is the basic course, such as the acupuncture course, that's the no minimum request. So it is from 0. So that's applied for everybody. No background. But of course, if you have no TCM any background, TCM foundation, if you apply the herbal medicine, of course you need to have the TCM foundation course first. So for acupuncture course, it is no minimum request to join, to apply.
Yeah. Yes. So what Professor Wang trying to emphasize is when you join, there's no requirement, but when you graduate, you need to finish the physiologies and everything, etc., anatomies. But we accept other colleges provided courses, all those results from their other courses, as long as they can, they apply to the same standard.
Of course, there are some common sense, such as you should have the minimum language request, because our course is English teaching. So your English should be, we say, the equivalent to IELTS 6.5. We do not need the ICE result, the mark, but of course you need to have some minimum request to understanding, and also some other the minimum high education, in such as high school, A level, on this level. But we will say we do not need any minimum request for the we say the anatomy, for the medical background. Let's make it clear. Of course, we said there are some common sense for as a high education, as a high school, or we can say the second school level. That's something like the minimum request.
Okay, so shall we finish tonight?
Yes. Any other final speech from Dr. Han, Dr. Tang, or Dr. Ye, or Dr. She? Yeah. If no question or no speech.
Okay. Thank you very much. Thank you for your attention. Yeah.
Yeah.
Yes.
Okay.
Nothing to say. Yeah. Thank you. listening. Yeah. Yeah.
Okay.
Yeah.
Thank you. Okay. Thank you.
Right. Thank you very much for joining tonight.
Thank you.
I hope you all
Bye
had a good informational evening. And we do hope we can see you soon in our brand new college, and we start our new learning journey together. All right. Thank you very much.
Okay. Thank you very, very much. And
thank you. Bye bye.
We have a good evening.
I suggest it's LACA staff to stay for a little long time.
Oh yes, Dr. Tang, no problem.
Yeah.
Yeah. Please, all our LACA lectures just leave some seconds. So for all other participants, thank you for your joining our this online open day. You are more than welcome to contact us. If you have any question, you can feel free to contact any of our myself or our colleagues, or through our website, our email, etc. For our any Chinese colleagues, you are more than welcome to contact me through our WeChat or any other other contact my email and phone call, etc. or our colleagues, etc. OK， 谢谢各位的参与，咱们晚安。哦，叶老师是不是离开了？铁军啊，有什么事？好像叶老师离开了。韩
没什么事，没什么事。那就这样吧。我们在微信里再有啥事聊，我觉得都挺好。今天总的来说还不错，是吧？
行，应该是总体来讲还是不错。
总的来说不错那么有什么事我们在微信里再。好
的。行，好的，你在路上，这还在赶路呢，所以
行，对，我在路上，对，我在坐车了，好。
要是我们再聊，或者我们再约个时间，我们单独再开会，我们再聊一聊。
不用，就随时在那个微信里留语音条就可以。
好的。
好，
再见，唐老师，再见，王老师。
好，那就这样了，好，拜拜，
再见，拜拜。好，这个客人先走，我最后一个。对。
你最后一个，我先走了啊，下了。
再见。石老师再见，石老师，
拜拜，王老师，
再见，拜拜。Okay, so still some of you are still in the room, so I'm sorry, we will end the meeting now. Thank you very much. Bye bye.
Thank you.